All right, sounds good.
And here listening to WBOE 1590 AM. It's Dr. Brown with Health Facts here on WBOE. Doc, take it over.
All right, thank you for that introduction as always. Good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So we're here for yet another show. It's for another show here. So as always, folks, we would like to say welcome to everyone listening on WVOE, everybody watching on us on Facebook, X, Instagram Live. We really appreciate you logging in and giving us a little bit of time. And even those folks that are watching this on a recording, we really do appreciate the time and attention that you're giving to us. And of course, if you like what you hear, feel free to give us a shout. Let us know if you like the show, have suggestions, and always follow, and share because we appreciate those likes. It lets us know that we're giving you good information that is serving you in terms of making your health a little bit better. Okay. So for today, we're going to revisit an oldie but goodie. I'm going to ask you this question. When was the last time you had your blood pressure checked? And I don't mean, I think it was 2 years ago, maybe last month, but when's the last time you had your blood pressure checked? And had it checked, wrote the numbers down, and know your number. When was the last time that was that? Okay. Because this number, every time I see it, I feel like it surprised me. Nearly half of the adults in the United States have high blood pressure, and many people do not know it. Okay, and that's according to the numbers from the CDC. Okay. And then for African Americans, we actually are a little bit more than half. We actually have the highest high blood pressure rates in the world. Some of the highest high blood pressure rates in the world. And for us, a lot of times it hits us earlier in life. It hits more severely, leads to higher, what we call end organ damage as well. And that's why, sometimes you have to say things more than one time. And that's why today's episode is so important because high blood pressure, also called hypertension, is called a silent killer for a reason. No symptoms, no warning, but very serious consequences. And today we're going to kind of go over it again. We're going to re-emphasize it again. And we're going to keep doing this until we start seeing some numbers drop down. Because, high blood pressure, honestly, it's not even just an issue for us in America, but it's actually a global. The JAMA, the Journal of the American Medical Association, recently had an article that they published, titled "Hypertension Burden Increasing Worldwide with Stark Disparities," and that was published on April 17th, 2026. And basically, just kind of the overall thing is discussing how global hypertension burden has surged over the past 20 years worldwide. They're estimating 1.71 billion adults, worldwide have hypertension, roughly 1 in 3 adults, and which is a pretty significant increase since 2000. Okay. So for today, we're gonna, go over some education. So we're gonna start out simple. What's high blood pressure? And blood pressure is the force of the blood that's pushing against your artery walls. And if you think of your arteries like pipes inside your home or like a hose pipe out there, you know, that blood going through it exerts a force on the outside. And if that pressure is high, and if it stays high for too long, those pipes wear down, they can leak, they can even burst. A normal blood pressure is around 120/70. High blood pressure is considered if that top number, systolic pressure, is greater than 130, or the bottom number, what called diastolic pressure is greater than 80. For the most recent American Heart Association numbers, that's high blood pressure. Because a lot of people, it used to be 140 over 90, and then they lowered that number to 130 over 80 because, they just felt like, that the studies were saying that number was a little bit better than the other number. But a lot of people aren't aware of this. A lot of people think that if their blood pressure is 150, some people even 160, they think their blood pressure is fine, but it's not. It's high blood pressure. And so the problem is this, when you have high blood pressure, you don't feel it. You feel completely fine. And that's why it's called the silent killer. So, and that's one of the reasons why we have to talk about it. We have to, keep emphasizing what's going on and keep touching base. And today's show is going to be a little short because I do have to, we do have a meeting that I got to cut. So I got to cut loose in about 10 minutes. But, that's the bottom line about what high blood pressure is. What are some of the factors that contribute to it? So lifestyle factors include like not getting enough physical activity, being overweight is huge, drinking too much alcohol, and poor sleep. We talked about the sleep last week. And then another one that's known is too much salt, but they're also finding out that extra sugar. They think that might be contributing to it as well. That excess sugar, excess salt are both contributing to high blood pressure. Stress is another one. If you have chronic stress, you're in a fight or flight mode all the time, it can raise your blood pressure over time. Okay, genetics. So of course, if your parents had high blood pressure, your siblings have high blood pressure, your grandparents have high blood pressure, more than likely you're going to have high blood pressure, and that's a genetic component. And then of course, social determinants of health also can contribute. And these things are things like less access to healthy food, having more fast food as opposed to like healthier foods available, limited spaces that are safe to exercise. Not everybody can just walk around their neighborhood. Higher stress levels, because if you're in an unsafe neighborhood, guess what? You're on a higher level. You got to be on alert all the time. And then barriers to healthcare. Suppose you got to, ride a bus, 30, 45 minutes because maybe they're not good bus routes to the nearest health facility. And all these things can play a role in being diagnosed with high blood pressure, and then also being treated for your high blood pressure. So if your clinic is 5-10 minutes away, you can go there every 2 weeks to get checked. But if you got to get on a bus and you got to do one of those exchanges where you get off this bus and onto another bus in order to get to the place that's treating you, yes, maybe you can make that once every couple of months. But if they're asking you to come back in 2 to 3 weeks, and you got to do this again, and you got to get out of work and things of this nature, all that stuff contributes to whether or not you're able to get your blood pressure under proper control. Because a lot of times blood pressure management you got to have labs, you got to get medications, you got to take them on a regular basis. You got to come back for follow up to get some additional, instructions about how to take care of things. So these can all play a role. Okay. And unfortunately, with high blood pressure, like I said, it's a silent one. So you can have high blood pressure without having headaches, without blurred vision, without dizziness, without feeling off. If you do have those symptoms, and those symptoms are related to your blood pressure, that's really a hypertensive emergency. If you got a headache from high blood pressure, if you're getting dizzy, if you got, things that are, chest pain or something of that nature, and it's from the high blood pressure, that's actually an emergency. And that means your blood pressure needs to come down now. But before you get to an emergency, more than likely, pretty much everybody will have some blood pressure that's been over the years, kind of gradually rising up. Okay. So what can you do? And this is where, we talk about this all the time. Primary care. Get you a primary care physician. Get you a primary care clinician, in nurse practitioner, physician assistant. Go see somebody. Okay. Go see somebody and see them before you need them, because you may, when you go in, you may or may not like that person. Yeah. So those sort of things play a role. And, you want to get to know that person, sooner rather than later, and establish kind of a reputation, kind of really establish a relationship with the person that's going to be taking care of that. Okay. So those things are pretty important there. Now, whenever if they do diagnose you with high blood pressure, then there are some tests that you're going to want to make sure that they get done. And one is some blood tests. So one of the things you want to keep an eye on are your kidneys. Hypertension is the #2 cause of people having chronic kidney disease. So your kidneys should be tested. It should be testing your urine, see whether or not you have this stuff called albumin. Make sure that's being checked as well. And then cholesterol levels, because and that's because you're part of managing high blood pressure is to minimize cardiovascular risk. And so cholesterol is going to be part of that as well. And so those are some of the tests that you would do in order to make sure that your body overall is healthy. Okay. And then, in terms of treatment, there's multiple ways to treat high blood pressure. Now, of course, the way I approach this is a lifestyle medicine physician. So we always look at lifestyle first. So one of the first things is, hey, what are you eating? What are you drinking? Are you exercising? Are you sitting on the couch? What sort of stress do you have? How do you sleep? That's kind of a lifestyle medicine first approach. Um, Lifestyle medicine first approach to what is going on there, and it's something that is that it's a new way of looking at high blood pressure. Now, just because we're doing lifestyle medicine does not mean we get to skip the regular medications. So you still may need regular medications even as you change lifestyle, but it doesn't have to be all or the other, because if you do the lifestyle medicine, even if you start out on medication, you may be able to decrease the medication that you're on. So I've had patients that, yes, they started off with maybe 2 medications, and they did the lifestyle changes and they were able to come down from 2 down to 1. So those sort of things are part of what goes on, right? So what do you want to do? So when you want to eat well, you want a DASH diet is great for people that have high blood pressure. This is a lower sodium diet. It focuses on fruits, vegetables, whole grains, lean proteins, low sodium. But there's also the whole food, plant predominant diets that you can do as a diet. And really, it's not really a diet. It's more of a change in the way you eat. So you want to, so lower sodium, so less than 2,300 milligrams of sodium a day. So those sort of things are from a dietary standpoint. Exercise, you want to get at least 150 minutes of activity every week. Walking counts. Walking counts. Don't just count walking. Try and get you about 10,000 steps a day. Sleep, you want to try and get you about 7 to 8 hours of sleep every night. And then stress management. You want to make sure that stress is under control. Prayer. If you pray or meditate, try and do that on a regular basis. And try to use that to help manage your stress. Take some deep breaths. And use that to kind of manage some of your stresses and kind of reframe what may be going on with you. That's another way you can do it as well. And then take time for yourself. Every now and then, a little self-care can go a long way in terms of managing some of your blood pressure. Another thing you want to do is avoid smoking. Smoking damages blood vessels, helps to raise blood pressure, and it's expensive. So don't just drop it. Just drop those cigarettes, right? So you want to do that. And so that's kind of our overall look at high blood pressure, kind of a quick, normally I'll talk a little bit longer, but of course I got to get to another meeting here. But let's just remember that, that high blood pressure is extremely important. Just also want to let you know that, May 17th is actually it is called World Hypertension Day. Let me get the right word here. Yeah, World Hypertension Day. And that is on May 17th of every year. And it's just to raise awareness about high blood pressure, how important it is to know your numbers, how important it is to get the care that you need. So I want everybody that's out there listening to make sure that they're not in statistics. You want to take control of your health care. You want to learn these simple things about getting your numbers checked, getting with making sure you establish with primary care. Don't forget about lifestyle changes and incorporating a healthy lifestyle into the way you live. This is not a diet. It's a way. It becomes a new way of life, and so you want to look into that as well. Also, mind your stress. Keep that stress down as low as you can. Take care of yourself and your body. Get some good sleep. Make sure you keep moving, and let's see if we can lower these rates of high blood pressure. So this is Dr. Christopher Brown. If you want more information, feel free to go to the.brown.com, THEDOCBROWN, where you can sign up for more information about high blood pressure. You can also go to PressureMD, www.pressuremd.com. As always, like to let you know that I'm a doctor, but not necessarily your doctor. So make sure you go to your doctor for specific health advice. And thank you for tuning in, whether you're tuning in live on the radio, whether you're tuning live on social media, or if you're watching a recording. And like I said, if you like what you see, like, share, and follow. All right. Thank you very much for your time, and we'll see you again next week.
All right, Doc. Thank you so much. You're listening to WBOE as we keep it going. It's Lee Williams and the Spiritual QC.